moving, and then we can go from there.
Okay, sounds good. So I'm here to talk today about the psychosocial aspects of care amidst the pandemic for carers, but also for patients. So a bit of background, I worked with the leukemia program for the last 8 years. Before that, I worked for 7 years on the floor in BMT and acute leukemia on 5 West at the Ottawa Hospital. So I transitioned from inpatient to now working with the outpatients. And working with the outpatients, there's a lot of time that you spent supporting patients with treatment, but then also a lot of education as well about how to navigate the world when the perception is a lot of times with, neutropenic patients, aplastic anemia and MDS patients, why do sometimes I have to be in hospital and sometimes I can be out of hospital, and what makes what safer? So the pandemic definitely added an extra element to that. So we'll talk a little bit about the concerns that I found to be raised. The first is a feeling of isolation, the access to care or perceived inability to access care. It's also a concern that was brought up and raised by patients. The impact of mental health on when considering the pandemic and the difficulties that provided, especially when you're in a position of being vulnerable and requiring a lot of support. The financial burden of the pandemic. Then we'll talk about kind of what we can do as healthcare professionals and what patients can do to kind of help themselves as well. And then at the end, I have the list of resources that I accessed. So first, for isolation. So patients might have a feeling of social isolation and also feeling physically isolated. A lot of that is, having to quarantine because of COVID-19. Also, the fear of getting the actual infection itself caused a lot of patients to isolate themselves. And that drives that social isolation as well. When you're physically isolated from people, you also feel socially isolated. And I think that was an important thing that happened through the pandemic was distinguishing between social isolation and physical distancing. And I think it was a very important change in the narrative, not only for patients, but also for the general public as well, to understand that it's not about isolating yourself from the world, but it's more about creating those safe distances to make sure that you can interact safely in the world. A lot of patients identified that they felt guilt because of the increased need of family support and the extra burden that they felt that it might place on the family unit itself. And a lot of times this guilt seemed to come from the asking the family for support, but then sometimes maybe asking family members to operate outside of the social distancing or physical distancing recommendations and what was being asked by the public health officials. A lot of patients also felt a high level of anxiety. So that surrounded the infection, getting the infection itself, what it meant for their treatment, concerns about contracting the infection, especially when when as a baseline, we emphasize, keeping masked, Purelling your hands, staying distance from people, going to stores at off hours. I found that there was also a big difference between patients that were diagnosed pre-pandemic versus post-pandemic and kind of what their ideas of staying safe and staying healthy meant. So for example, for patients that were diagnosed kind of after the pandemic, they kind of felt like they had a handle on things because it was reiterated in the media all the time about hand washing, wearing masks, staying safe. Not only was it important for the general public, but also important for our neutropenic patients. So they were a little bit more comfortable with the idea and a little bit more comfortable with the teaching, although there was still that anxiety and fear because COVID-19 was being spoken about so much in the media, and it was kind of right in our faces. The other thing that was identified was, the fear due to their immunocompromised state and kind of perpetuating that feeling of isolation. So making them feel more and more like they needed to stay at home, when kind of the goals of treatment overall for aplastic anemia and MDS patients and even our leukemia patients is to help them manage with their disease, give them a good quality of life, but then to also spend time with family and friends and kind of go about their life as they can. So adding the pandemic in there, it definitely added a twist into things where patients weren't able to kind of get together with their family members, but it was about, also being creative about how we can circumvent that. So with media and that kind of thing. But because we were telling them on one hand, we're doing this to help them and to help with their quality of life, the fear of the infection was so great that it was also forcing them to be more and more isolated. The other thing that was very difficult was the loss of social supports. Because of the recommendations by the World Health Organization and public health officials, there were a lot of resources that were deemed not to be mandatory, but also because a lot of our patients rely on volunteer drivers to help them come to and from treatments, the volunteers weren't being put into a position that they were going to be compromised. So that eliminated some social supports and some resources that are normally in place for these patients. Also like meal deliveries and that kind of thing. This, I think, was particularly difficult for a lot of our patients because they rely on these extra resources along with their family members to help them out. There also seemed to be a very big issue with the access to care, or the perceived inability to access care in some instances, or the hesitation to do so. So the delay or modification of treatment due to either contracting COVID-19 or to try and protect the patients from exposures. While those delays and modifications that may have been made to these treatments, under certain circumstances, the benefit and risk may have been weighed. It was weighed heavily, but also it did cause a lot of anxiety and stress for the patients because their treatment timing was not kind of kept up to schedule. And although the patients understand that, we're doing the best to help them and make sure that they're safe, it didn't eliminate that fear from the patients, about whether or not they're adhering to their schedule and what that meant for their overall disease. Fear of contracting the virus itself was another thing that kind of limited patients' access to care. 29% of patients that were looked at in an article by Supportive Care in Cancer reported that they avoided the emergency room because they were more fearful of contracting COVID-19 than, for whatever reason, would bring them to the emergency room in the first place. Ultimately, it ended up, reducing the access that these patients had to supports from the healthcare team themselves, and sometimes from their family members. So it limited their ability to reach out, or their comfortness with reaching out to have the family support. Travel restrictions also kind of limited patients' ability to access care So if someone was had to travel from far away in order to receive treatment, especially in some of our more rural areas, that was a big burden to carry, because they were restricting the flights and patients' ability to move, and weighing the options of potentially getting sick on an aircraft or in other modes of transportation were weighed heavily, and oftentimes it contributed to fear and anxiety again to patients. Patients also felt like their needs maybe weren't met. And there was a huge fear of recurrence of disease. Main concerns were their patients' ability to access professional counseling, their ability to get test results, or being informed of results of different scans in a timely manner. And they also, a lot of patients did express that they felt like sometimes they weren't being treated like a person. The fear of recurrence of disease was experienced in 95% of patients through several studies that were done. Especially in the paper that was published in Support of Care in Cancer, which you'll find in the resources as well. So that's a huge number of people that were concerned about relapse and recurrence of disease. Mental health was a huge component as well. There was a lot of fear that patients expressed. And this was the most prominent emotion that it was expressed by patients. Patients also expressed a low level of emotional well-being. So their lack of ability or, to interact with other people, fear to access resources, that kind of thing. And a lot of it, again, stemmed from the fear of contracting the disease itself. Patients felt overwhelmed as well by all the information that was being given to them, but also the change in guidelines and the change in, how healthcare professionals provided care, and how the public health officials also shared information. People were concerned with irritability and uncertainty, depression, anxiety, and, that was really driven by the changing face of healthcare and the regulations that were put in through the pandemic. The feeling to need to stay home also perpetuated feelings of loneliness. And so the uncertainty, the depression, the anxiety, the loneliness, this was all kind of circular, and they all fed into each other. Already dealing with a diagnosis of, cancer or aplastic anemia or MDS, it already puts the patients at in a destabilized state. So this forced individuals to deal with their already life-threatening situation, and add a pandemic where the fear of getting an infection sometimes was worse than, the disease itself. There was also some indication that there's financial concerns for patients. So whether that be due to loss of income, job loss, or higher level of or the highest level of concern was seen in younger patients compared to the older patient population. It didn't really discuss why that was, but I mean, there's a variety of reasons. I guess when you're young, you have a young family, and you lose one income already because one person is sick, and maybe your spouse loses their job as well for whatever reason through the pandemic. That can put a large burden on families. So loss of income from family and caregivers, again, not able to work because of the pandemic restrictions, added these feelings of stress and depression. I'm going to show you now a diagram that kind of breaks down kind of different aspects of treatment and kind of the level of fear patients felt when it came to COVID-19. Just kind of a bit of a synopsis here that you can see, and this again was taken from one of the papers that's in the resources. And so it breaks it down, and basically, like, there was a lot of fear and anticipation associated with a lot to do with treatment. Mental health was a big concern. Treatment schedules, another big concern. And so that's just something that you can look at on your own, and it'll be provided with the slides there. So what can we do to kind of help these patients and help kind of ease their mind and help them manage through these concerns? So number one, the use of technology. So this was really important in making sure that we stayed engaged with patients and to reassure patients and address their fears and concerns. So the use of telephone call visits, the increase in telehealth visits, as well as using Zoom as a secure way of being able to see patients. It's always best to assess a patient in person, although sometimes, because of the pandemic, it didn't allow for that to happen all the time. So the use of Zoom and telehealth was a good strategy to help us physically see the patients through the screen, and be able to give a better assessment versus just talking to them over the phone. It also allowed them to access other resources like social work and psychology without having to come into the hospital all of the time. As we know, the more you're out and about, the more you're accessing the hospital where people are unwell, the higher risk you are at getting an infection. So giving patients to adjust to the new normal, right? As the pandemic went on and, we were able to have vaccines that come out, the easing of restrictions, that kind of thing. It allowed patients to have a better understanding of what they needed to do to be safe, and also provided them some reassurance that if they maintain the health guidelines, that it did really lower their risk of getting an infection. Vaccines is a big one, although it's a hot button topic. The addition of the vaccines for COVID-19 did help to ease concerns for sure. It also reduced the severity of infection, but it allowed patients and families to be more comfortable with allowing supports to come into the home, but also lowered the burden on patients. And they didn't feel so bad about asking their family to come. Now, the patients and the families were all being protected against COVID-19 with these vaccines, and it made it a safer environment. PSOP, so psychosocial oncology programs. These were really important throughout the pandemic, and especially linking patients in with psychiatric help, psychologists, as well as social work. Very important. A lot of it was because with the ever-changing pandemic, again, the fear of loss of finances, the anxiety, the depression, the irritability, the feelings of loneliness, it was really important to tie these patients in with social work who could help them access resources, financial or other supports, as well as someone for the patients to talk to. Now, although, as one of the clinical nurse experts, I was always there for my patients to give me a call and to have a chat. However, sometimes having a regular psychologist be available to help work through a lot of not only the feelings through the pandemic, but also being a patient that's dealing with cancer and treatment and all those fears that come along with it. They were a good resource to kind of tie things in, and it was a good support for the patients. So developing creative ways to cope. So tying in patients with PSOP and having that psychosocial oncology program to kind of help. It also allowed patients the ability to explore creativity and coping and figuring out how they can manage through the pandemic and maybe not feel so lonely or not feel so isolated. And so things like encouraging them to use different technologies, FaceTiming family and friends, getting onto community support groups. Those were things that were really important to encourage patients to do. And that did help with kind of reducing stress and anxiety. Another thing that was really important that can help patients to feel better and feel more secure and maybe decrease some of the anxiety is trying to maintain appointments and treatment schedules as much as possible. Now, this can't always be done for whatever reason, for infection or delaying of treatment because of neutropenia and that kind of thing. However, if at all possible, if patients were maintained on their appointment schedules and their treatment schedules, it did reduce anxiety by a significant amount. So altogether, I mean, patients and the healthcare team can work together in order to help reduce a lot of the concerns that patients had throughout the pandemic. As we move through and continue to navigate COVID-19 in kind of the world of aplastic anemia and MDS and leukemias, as well as other cancer care areas, it's important that we keep in mind that, the words that we use in discussing, hand hygiene and what isolation really means and what staying safe really means, and, encouraging patients to reach out when they need help, and making sure that all those resources are available. Here's my resource page here, and all of these are available in PDF versions, which I can provide as well if you'd like them. But yeah, that's my presentation for today.